Good evening everyone. I am Dr. Murali from India. Now I want to explain about how to identify the sphenoid osteum in regular face. I will tell you in simple situations and in difficult situations where you couldn't find the sphenoid osteum in boggy mucosa or extensive diseases of sphenoid and post-ethmoids. So there are four ways. One, always we have to do middle meatal antrostomy and identify the maxillary line, that is the lower border of lamina papyracea. That is method 1. Method 1 is first we have to identify the maxillary line or lower border of the lamina papyracea. If you extrapolate that backwards, that exactly goes into sphenoid osteum. That means when you are doing intermediate approach, if you extrapolate the maxillary line, that exactly points to the sphenoid osteum. So this is very important. So in face, without identifying the maxillary line, never go into the post-ethmoids, never go into the sphenoid. This is funda. So extrapolation is imaginary line, or if you go backwards, it exactly bisects, it exactly goes to the sphenoid osteum. When you are crossing the vertical part of the basal lamella, when you are delineating the maxillary line, certain cells present at that area. So always clear the cells in the posterior ethmoidal area and at the maxillary line especially, and go backwards. Okay, this is method 1. Next is method 2. Method 2 is upper border of the posterior choana, 1 to 1.5 centimeter above the upper border of the posterior choana. Take septal elevator and just palpate that area. You will get a dip. Even in boggy mucosa, you will get a dip, or you get the bubbles. That is method 2. Next, method 3. Method 3 is the PJ wormhole technique. That is, the superior turbinate, if you divide into lower 1/3 and upper 2/3, exactly at the junction of lower 1/3 and upper 2/3 of the superior turbinate, it is point of sphenoid osteum. Okay, even in all these three methods you couldn't identify the sphenoid osteum. Next step is, that is method 4. In method 4, take a septal elevator. Suppose you are trying to identify the sphenoid osteum on the right side. You pass the septal elevator from the right side and detach the posterior septum from the sphenoidal keel. That means keep a septal elevator from right side and push the posterior septum towards the left side. That means you are detaching, you are breaking the posterior septum from the sphenoid keel. Then you will identify the sphenoid keel in the center. Then depress the sphenoidal mucosa, that means, depress the mucosa which is present over the anterior wall of the sphenoid downwards, both on the right side and the left side. Then you will identify the sphenoid osteum on the right side and left side. Take a lux or any forceps, which is tough, and break the sphenoid keel. Then you will identify the sphenoid cavity directly in the midline. So these are 4 steps. The last resort is breaking the sphenoid keel itself. We regularly do this in pituitary surgery. So in extensive fungal sinusitis or extensive polyposis, where it is very difficult to identify this, you can apply this one. That is breaking the posterior septum, detaching the posterior septum from the sphenoid keel and breaking the sphenoid keel and directly identifying the sphenoid cavity from the midline. Then you can enlarge the cavity by nibbler. So this is fourth method. Okay. So when you are facing difficulty in identifying the sphenoid osteum by going intermediate approach in phase, you can go below the superior turbinate and break the posterior septum, detach the posterior septum from the sphenoid keel and remove the keel with lux or any other forceps, tough forceps. That's it. So in these four methods you can easily identify the sphenoid osteum. In beginning of our career, we may go very up and we may enter into the posterior ethmoidal area and at the planum area. So always when you are trying to identify the sphenoid osteum, always see the posterior choana and try to assess, are we crossing 2 centimeters or more than 1.5 centimeter above the upper border of the posterior choana. So when you are doing all this posterior ethmoids and sphenoidal work, always keep an eye on the regularly. Every 1 minute you see, observe the posterior choana, so that you will never miss into that planum area or posterior ethmoidal roof area. So always you keep an eye posterior choana and roughly you assess whether you are just above 1 centimeter or 1.5 centimeter. Don't go more than up. I mean, don't go in the upper half of the superior turbinate. So always the sphenoid osteum is exactly at lower 1/3 and upper 2/3 of the superior turbinate. So try to search at that area. Keep a drill mop. Wait for some time. The whole mucosa will shrink. Then take a elevator and try to dip. Give pressure. You will get bubbles or you will get a dip. So this is, in these four methods you can identify. Okay, thank you.